Hello, greetings. This is Christine So from Global Health Council. We are going to get started in just a couple of minutes. We've opened the lines and are just allowing people to join the webinar. So please be patient and we will be back on in 2 to 3 minutes to start the webinar. Thank you. Hi everybody, this is Christine So from Global Health Council. Welcome and thank you for joining today's webinar. This is the second in our World Health Assembly Scrum series. These webinars are intended to provide briefing and a chance for discussion around issues that will be on the WHA agenda later in May. Global Health Council is a membership organization. We're made up of a big tent of members. So we have members from NGOs, corporates, academia, philanthropy. We work closely on raising the visibility and investment and priority in global health issues with the U.S. government as well as at the global level. One of the benefits that we offer our delegates is, our members, is a chance to be a delegate at the World Health Assembly. And please stay tuned in the coming weeks. We'll be getting out more information about events to take place at WHA as well as a consolidated master calendar of events there. I'm going to turn over the mic to Liz Colway, who's going to walk us through the logistics on the webinar, and then we will introduce our speakers. Liz? Great.
Thank you so much, Christine. So on the screen, you can see how you can ask a question during the webinar. You can either wait until the end of a presentation, or you might choose to just send your question during the actual presentation. And we just ask that you use the chat box on the GoToWebinar platform. And please also state your full name and organization so we know who the question is coming from. And also, if you are directing it towards one of our panelists, please indicate who. Or if you'd like, you can also send a question to my email, which is ecolway, K-O-H-L-W-A-Y, @globalhealth.org. And something else I just want to remind everyone, we are tweeting this webinar, so if you would like to share your thoughts through Twitter or Facebook, you can use the handle @globalhealth.org and the hashtag WHA69 and hashtag GHC Policy Scrum. So with that, I'd like to introduce our first speaker for today's Policy Scrum, who is Zoe Gray.
Great. Thank you, Elizabeth, and thank you, Christine. So I'm the Advocacy Manager. Can you all hear me, by the way?
Yes, we can.
Yeah, great. Okay, so I'm the Advocacy Manager at the International Agency for the Prevention of Blindness. Just to introduce you, IAPB is an umbrella body, a membership organisation with over 125 members around the world working in eye health and also on disability issues. In relation to preventing and restoring sight loss and also promoting the rights of persons with visual impairments. Today I'll just give a brief overview of the Global Strategy and Action Plan on Aging and Health, one of the areas that we've been working on in the last year, why we think it's important, and some possible areas of engagement for Global Health Council members. Next slide, please. Thank you. So why is action on aging and health essential? In spite of the changing demographics, the increase in aging populations, although to some extent there's length and longevity, there's massive inequity both in life expectancy across countries and also in terms of healthy lives. So people are living longer, but they're not necessarily living healthier. And those most in need are often those who have the least access to health services. Regarding eye health, higher proportions of older people are affected by eye diseases, and many of these conditions are often avoidable. And the vast majority of these people live in low and middle income countries, and poor and marginalised groups are less likely to access services that they need. So this applies both generally and also to eye health. Although there is major diversity, of course, amongst older persons in terms of their health needs, on the whole, older people are vulnerable to ill health, and there is an attitude and expectation often of decline, which can risk in marginalisation, isolation and discrimination. I've just mentioned some points regarding what is needed, but we'll cover that within the strategy and some of the benefits as well of improving healthy living for older persons. Next slide, please. So the Global Strategy and Action Plan, just to pull out some key points here from our perspective, why it's so important and why it's such an important and welcome shift. There are so many positives within the strategy and action plan. Of course, there's a big difference between having a policy on paper and actually implementing it in practice. But at least in terms of what kind of detail is in there and the kind of concepts used, there are many very great steps forward. There's a big emphasis on valuing the older person, ensuring that health focuses not just on extending lives, but also on improving lives. There's a big emphasis on multi-sectoral approaches, so both within the health system and also the care system as well, and long-term care systems. There's also a big emphasis on addressing social and economic determinants, acknowledging the differences in terms of access to services to people from different backgrounds. It also acknowledges failures to tackle avoidable conditions such as NCDs and the need for providing appropriate support and enabling environments when diseases that affect people have caused impairments which are irreversible. One of and I'll talk about a little bit later, is some of the background and the concept behind the Global Strategy and Action Plan is in the World Report on Healthy Aging. And this concept is on healthy aging, and there's a lot of references throughout the Global Strategy and Action Plan on functional ability, and it's defined in the World Report as the process of developing and maintaining the functional ability that enables well-being in older age. So this functional ability is determined by the intrinsic capacity of the individual, i.e. the combination of all the individual's physical and mental, including psychosocial capacities, the environments he or she inhabits, understood in the broadest sense and including physical, social and policy environments, and the interaction between these. A considerable effort has been made within the GSAP to align and complement the SDGs, and there's quite significant overlap with SDG 3, in particular on health, and as we know, the title of the SDG 3 goal relates to health and well-being for people at all ages, and also there's great overlap with the goals on inequalities and also on sustainable and inclusive cities. There are also efforts as well to be complementary to other frameworks such as on NCDs and on disability and amongst others. So that's just a sort of an overview of some of the kind of key concepts and areas that are covered. So I'll go on to the next slide and give some background on how we came to what point we're at on the Global Strategy and Action Plan at this point. So a couple of years ago, a request was made at the 67th World Health Assembly, 2014, to develop a Global Strategy and Action Plan from 2016 to 2020. As mentioned, there was a seminal report on ageing and health which was published in September 2015. There's been a round of different consultations in the last year or so with member states and also civil society involvement, some online and also some consultation in Geneva as well. And this has led up to the most recent draft, which was sent to the WHO Executive Board in January. On the slide here, I've put a link to a summary of the report at the Executive Board because it gives some information on some of the different countries' perspectives in terms of what the content of the GSAP is and also how well received it seems to be at this stage. It's due for adoption in May 2016 and at the WHA, and at the moment we're pretty hopeful that it is going to be adopted, but obviously you never know what's going to happen in the days leading up, but certainly we don't have any intelligence otherwise, and we're hopeful that it will go through at least more or less as is. Just to cover a couple of comments from the member states, they really emphasised the importance of implementation. Obviously there's lots of WHO action plans and strategies and others, and often there's, well, a limited level of both monitoring, evaluation and of course implementation. They also requested budget estimation and resource allocation plans and emphasised the need for measurable indicators. They emphasised the need for the multi-sectoral approach, which is, as I mentioned in the previous slide, there is quite an emphasis on joining up and in having an integrated, comprehensive approach to both health and to long-term care. Other areas they emphasised was the importance on rights, gender, long-term care and dementia. So for the most part, really reiterating the kind of areas that are already within the strategy and action plan. Australia suggested to develop a resolution, and WHO will be working with Australia on this resolution. IAPB has been involved in some of the different consultation processes, as have been a number of other ageing groups, but although I think it was a reasonably open process, the numbers of different civil society organisations and health organisations involved has been, I would say, relatively limited, so there may be much greater scope to get involved in the future. Next slide, please. So this slide describes, as you can see, the goals and the objectives. Just as you can, there's two goals that the GSAP has. One relates to basically action in the next 5 years, which links into all the different objectives, and the other one is about establishing evidence and partnerships necessary to support a decade of healthy ageing. So that's the long-term focus of the GSAP, is to lead into a decade of healthy ageing. There are 5 areas of objectives. The first one is commitment to action on healthy ageing in every country, and essentially this objective includes actions in relation to developing national policies and national action plans, ensuring there aren't discriminatory frameworks, reviewing and tackling those kind of frameworks, and taking steps to set up the planning and mechanisms to have a different approach to healthy ageing in the different countries. The objectives that we're particularly interested in relate to age-friendly environments and aligning health systems to the needs of older populations, but I think there's a lot of complementarity and overlap across all the objectives. On age-friendly environments, just to pull out the sub-objectives, these are on fostering older people's autonomy, empowering or encouraging engagement, and promoting multi-sectoral action. And the age-friendly environments objective encompasses, it's quite a broad interpretation of what an age-friendly environment is. So it incorporates help for people within the home and community, and also such sectors as transport, housing, social protection, streets and parks, social facilities and so on. So it is quite broad and relates a lot to social and health and environmental determinants of health. And obviously from our perspective we are very welcoming of this holistic and multi-sectoral approach, and this push for joined up approaches across sectors and better coordination across sectors. The other objective, as mentioned, that we're particularly interested in, and when we made submissions was an area that we were keen to ensure that iHealth was addressed within it, was aligning health systems to the needs of older populations. There's 3 sub-objectives, and these relate to orienting intrinsic capacity and functional abilities, affordable access, and workforce. So having the right workforce to be able to take care of the needs of the older populations. I mean, for us, they cover so many absolutely essential areas in relation to the equitable and affordable access, responding to health needs across the continuum. There's many mentions within the text relating to the importance of covering promotion, detection, screening, treatment and rehabilitation, so quite a lot on both early detection and treatment, and also ensuring that when there are irreversible impairments such as blindness and vision impairment, hearing loss and other areas, that there's sufficient management, support and also access to assistive devices as needed. So very much a comprehensive approach and holistic approach to an understanding of what it means to be healthy for an older person. Next slide, please. So just regarding opportunities for GHC engagement, the GSAP is a really important opportunity to address the healthcare and support needs of older persons. We've already mentioned the high numbers of people, the changing demographics, and well, how important and also how right it is to address the needs of older persons. And there are a number of areas for engagement. Firstly, in the run-up to the WHA in May, possible areas could include supporting and helping publicise GSAP, both sort of at international and global levels and also down to regional and global offices of NGOs and so on, so that there is an awareness of this process. Within the WH itself, to potentially advocate for changes or maintain positives amongst country delegations. As mentioned, from IAPB's perspective at the moment, we're pretty happy with a lot of the content, so unless we hear otherwise that there's any plans for any major changes at the moment, we'll just be supporting the push for its adoption. There will be some side events at the World Health Assembly on ageing and health. At the moment we have information that there will be 2 that we're aware of. One will be led by the WHO. We don't know at the moment what the focus is. In the GSAP there is a section on milestones, and it is likely that there, and what steps are going to be taken going forward in terms of the GSAP, so it's likely that the WHO event is going to cover some of these. The other event is a civil society-led event co-hosted by HelpAge, IFRC and IFA. They are in the process of planning exactly what the focus will be, and I should have some details on that in the coming weeks, and I'll be happy to share details on both as I receive them. As mentioned, there are a number of milestones in the GSAP process, which leads up to the sort of implementation both of the plan at the international level, regional level, national level, and also moving towards the decade of healthy aging from 2020. One of the major milestones that's sort of coming up quite soon is the development of progress indicators in December 2016, or that's the date that it's planned that there will have fully developed progress indicators. When they released the draft 1 of the GSAP, they included information on gaps of evidence what kind of information should be needed or taken to measure progress on the GSAP. So they suggested possible indicators across the different objectives. However, that was taken out of the later draft that went to the executive board, but it could be something to refer to in terms of getting a sense of kind of what kind of indicators that they have in mind, and I imagine it may inform some of the discussions coming up. The final point is, you know, at the end of the day, these action plans, for them to make a major difference, will have to translate both to the regional and also to the national levels. And there will be, as mentioned in the GSAP, there will be development, well, in some cases there are already regional strategies which will be reviewed and revised potentially, and there will also be development of new regional strategies and also of national level strategies. So there will be a considerable need to get involved and participate to ensure that these are geared up to, you know, best include older persons and to best ensure that the health needs of older persons are tackled in a way which is comprehensive, equitable, sustainable, and so on. IAPB is planning to continue contributing to the process and ensuring our key messages are maintained within any further iterations, any development of the indicators, any other important documents that feed into the decade on ageing. And we also are most likely going to get involved in encouraging our members to get engaged at the national level. So in practice, you know, the difference that is needed to be made for older persons' health is actually happens in practice. So that's it for me. Thank you.
Great. Thank you so much, Zoe, for that very informative presentation. So at this time, I'd like to invite participants to submit questions to the chat box for Zoe, and I'll give everyone just a minute to type out their questions.
Hey, this is Christine. After Zoe, which I was just curious if you know about what the history of aging as an issue at WHO and WHA has been. Is this something that has been addressed in previous health assemblies, or has been, you know, a real priority for WHO, or are we really seeing this appear for the first time? Thanks.
Thank you. I should answer now, shall I, Elizabeth? Yeah, I guess so. Sure.
Yeah, you're good.
So from what there was a plan of action, the Madrid plan of action. If I remember correctly, it was from about 2002, and there was also a WHO program or plan on healthy aging from around that time. I haven't been involved on it going back I haven't been involved in it past the last sort of couple of years, but certainly the GSAP acknowledges that there was some useful focus within those plans in terms of rights and acknowledging diversity of older persons, and basically the need to you know, greatly improve the health and lives of older persons. But the GSAP also acknowledges that basically not near enough had been done. So I think historically there were quite a few good things maybe on paper, but not so much has happened in practice. And I think also that the GSAP has sort of taken further steps in terms of having this focus on functional abilities, so sort of let's say traversing between both the care and health aspects And more coordination. And I think also the other thing that's different perhaps, or at least that they want to concentrate more on at this stage, is a much greater emphasis on equitable access, so ensuring access for all older persons to the health systems and the health services that they need.
Great, thank you so much for that answer. So I think just in the essence of time, we're going to move on to our next speaker, and then I still invite people to ask questions and we can address them at the end of the webinar. So with that, thank you very much, Zoe, and I'd like to introduce our next speaker, who is Justin Kosterd. He is the Senior International Relations Specialist for Medtronic, which is the world's largest independent medical technology company. He spent the previous 5 years focusing on increasing market access for Medtronic's innovative medical technologies in emerging markets. Justin also currently serves as the co-chair of the Noncommunicable Disease Roundtable, an independent advocacy organization seeking increased attention and healthcare policy that strengthens the prevention, diagnosis, treatment, and the control of NCDs. So welcome, Justin, and over to you.
Thank you, Liz. Thank you again, Christine, for having me on in advance of WHA. And NCDs is a notably extraordinarily broad topic, and but I have only prepared 3 slides so that we can maximize questions at the end. But again, I'm happy to address again any questions that come forward from either the GAC directly or from anyone on the line. So thank you again for the introduction, and if we could move to my first slide. Okay, so getting right back to most recent history, and again, if it would be helpful, I could go back into the longer history back to 2011 of NCDs, but for the purpose of this call and really gearing people up for WHA, I thought it would be good to start with where have the latest discussions been. So, and the most critical juncture for our movement was at the WHO Executive Board in January of this year, and they are actively gearing up for our next high-level review of the NCD community in 2018. So that's bullet number 1. Overall, the WHO Executive Board is somewhat disappointed with the progress to date for the NCD community in that we haven't seen notable progress towards many of the targets, and they're also overall noting the lack of accessible data, which was a very fundamental need at the outset of the movement and was acknowledged at the start, but they thought they would make more progress between 2011 and 2016. So again, towards the 9 global targets, overall lack of progress, an emphasis that national action is where the action should be, and then a highly resolved focus on getting to the data and better surveillance for NCDs. The other agenda item at the WHO Executive Board that was critical to the NCD movement was the Sustainable Development Agenda. And again, we were very pleased to see that NCDs were included in the Sustainable Development Goals last year, but also that they are being actively pursued via the right approaches as well. So the same priorities that came out of the 2011 high-level meeting for NCDs, they have continued into the text. So the key here is that NCDs were included in a multi-sectoral approach, just like my aging colleague Zoe pointed out. It's critical for NCDs moving forward. So next slide, please. Liz, can you hear me? Oh, there you go. So just highlighting some major trends that happened in the NCD movement over the last year, I would highlight two. One is that the NCD Alliance and the WHO hosted the first ever global NCD forum, which the focus was bringing country-level advocates and NGOs and representatives from as many countries as possible together for the first time to really have a coordinated movement and on the ground, because again, the focus for NCDs moving forward is not so much at the global policy level, but at the national level. So with that, in Dubai in November 2015, we had over 250 participants from over 60 countries. And again, the discussion and the context and the trading of ideas and best practices for advocacy for NCDs at the country level was robust, and I believe they plan to continue with another global forum within the next 18 months. The other, in parallel, I would say the governments are also getting organized. So the WHO just 6 weeks ago hosted one of the first ever national government NCD forums for government directors and managers in NCDs. So over 40 countries sent delegates to participate in this global meeting in Geneva. And again, the outcomes, and they provided opportunity for NGOs and the private sector to engage. But again, the takeaways and the feedback from the discussion was that it is very positive and robust. And again, a lot of the challenges for governments are shared, and they go back to the same problems that I addressed in the first slide of the executive board. So the need for better data, again being very primary, and then again slower than expected progress towards the targets. So that being said, there's a lot of other things that have tangential but very important benefits to the NCD community, and a lot of things are moving forward in a positive direction. So NCDs have been positively included in other agendas as well, because again, there's a lot of synergistic overlap in terms of solving the underlying needs for NCDs in other areas. So highlighting that NCDs are relevant and matter to maternal and child health. The NCDs were positively included, and the stakeholders from NCDs were included in the framework of engagement with non-state actors at the WHO Executive Board. And again, a lot of interplay and activity between women, children, and adolescents' health. As again, Zoe mentioned several times NCDs in her aging discussion earlier, as well as something I'll turn to in a little bit more detail, which is climate change, but also the refugee crisis again underlines a lot of the needs of the population moving from the Middle East to the EU and the war and crisis there. But so turning back to climate change, the NCD Alliance just released a very substantial report, and I didn't include a link on it to the slides, but you could find it pretty easily. They released a very large report discussing the overlapping priorities and needs for NCDs and climate change. So again, for advocates in this area, if you're looking to bolster your argumentation for climate change with the significant needs of chronic disease and non-communicable disease patients globally, please look to that piece of information for your tools. Liz, can we go to the next slide, please? So finally getting to the topic of the hour, the agenda at WHA for NCDs has never been as robust, I would say. The NCD Alliance will be holding a preparatory briefing and webinar that if you log onto their website, you're able to RSVP and access in the next couple of weeks. That will be held on May 11th. The NCD Alliance itself will be holding a half-day event on Monday of WHA. and then they will also be holding another official event on healthy workplace on Wednesday during WHA. And then again, highlighting that the NCD Alliance and the NCD movement is made up of many different federations and interested parties. So you can see events, and again, diversity of them, including the World Heart Federation holding a cardiovascular disease event, as well as a rheumatic heart disease event that, full disclosure, Medtronic is sponsoring. Secondarily, the NCD Child will be hosting a breakfast, which is a separate organization in and of itself. And then lastly, there will be, there's several more that are still to be confirmed that are not yet on the agenda, but Help Age International and IFRC will be hosting, as Zoe mentioned, a launch of the WHO aging report. And again, there's also potential for several other items. The rest are completely unconfirmed, so I will leave them up for questions and answers from those attending the call. Thank you very much for your time, and I hope I was able to kind of give you opportunities to plug in. Again, the NCD Alliance will be hosting a prep briefing, and we'll be launching talking points and advocacy points as 2 weeks out from WHA this year. But again, I can send a list of events in more detail if that's required, if you would like to plug in while you're at WHA this year as well. Thank you, and look forward to your questions. So I'm seeing that there's 2 questions posted at the moment, and one is from Habib from NYU, and so no surprise since global oral health is generally neglected, and if there's any recognition, the focus is on younger age groups. However, aging and oral health are highly important. So I think, Zoe, both of these questions are semi-related to you. Are you available and able to answer?
Sure, I can certainly do my best. Thanks, Habib. I have seen some reference to, I'm not sure from your question, are you saying that they're not in the strategy? I did see some reference to it possibly in previous drafts or in the summary of comments from countries. So that's the link on the slide that I provided. So it's well worth checking that out, because especially if some of the countries have raised it, and I'm right about that, it could be that they're either those minor, the WHO did say that some minor changes are already happening. I haven't seen any of these accounted for, but it could be it has been integrated, or if not, that there's quite considerable scope to get something on that in. And then the second question from Anthony, is there a big emphasis on integrating older persons into specific health actions like NCDs, HIV, etc.? So I just recalling my knowledge of the text, there's quite a bit of emphasis on trying to have linkages across and complementarities with the different strategies, including the NCDs, ones on disabilities. There was a number of other different areas covered. I'm not sure about HIV. So there's intention for complementarity. Within the objectives, there are some actions in relation to developing national action plans on aging. I can't recall whether there is anything within the objectives or sub-objectives objectives of ensuring that aging is incorporated within these other strategies. So perhaps yes and no, so maybe there's some scope for linking into that, but I'm not sure that it's completely linked up in terms of the objectives and actions. So the intention is there, but whether the current draft makes a clear link, I'm not 100% sure.
Great, thank you both for fielding those questions. And we just had one other note, and that's just to mention that the agenda item on the UN Decade of Action for Road Safety actually also falls under NCDs. And Handicap International has proposed a side event, but they're still waiting on confirmation for that. And I'll just wait another minute or two. I think there's a few other questions coming in. I'd like to just remind everyone on the phone and through GoToWebinar that we will be posting both the slides with the links and also a recording of the webinar on our website. And I'll send out a link to everyone who's called in today. So you should get that in a few days. Okay, so while we're still waiting for some last-minute questions, I'd like to just give everyone a few reminders of what's coming up. So our next WHA Policy Scrum will take place on April 19th, and that will be on emerging infectious diseases and preparedness, surveillance, and response. And again, the 69th World Health Assembly is in May. GHC is attending with a delegation, and for more information on hotel room blocks, calendar of events, I know some were mentioned in today's presentation. As we gather more details on those events, we will be posting them to our website, and you can check it out all at globalhealth.org/GHC-WHA69. And like I said about the events calendar, again, it's on our website. If you have any events that you know of and have not been mentioned yet, please feel free to email them to events@globalhealth.org. And if you are a GHC member, you can submit statements to GHC for review and possible inclusion in GHC's submission to the WHA official record. And again, all the information, including the WHA statement submission guidelines, are on our website.
Yeah, so with that, thanks very much, Liz, for giving that overview. And we're looking forward to World Health Assembly this year. I think we heard Justin, note that it's going to be really robust for concerning NCDs, but we've got a really interesting agenda coming up, and I know it will be the occasion for a lot of discussion and hopefully some progress. So I want to thank our speakers again, Justin and Zoe. I'm particularly pleased that we were able to have aging as a topic for one of our scrums, because it is one of these emerging areas that is going to become increasingly important and really hasn't gotten a lot of policy attention. So we're looking forward to being able to collaborate in the future around the area of aging and how it connects with NCDs, but also how it connects with all sorts of other global health issues such as health system strengthening and universal health coverage. So with that, I encourage you to attend our upcoming scrums. We're also going to be holding a number of other webinars in the next few weeks. On Monday, April 11th, we will be doing a webinar in French on the Global Financing Facility. And then on the 22nd of April, we will be doing another GFF webinar, which will be focusing on how GFF is working at the country level. So please check out our website for information on those and other webinars and activities and events that are coming up. And we will look forward to connecting with you again very soon. Thanks again to Justin and Zoe, and please take care, everyone. Have a good rest of your day.
Thank you.
Thanks.